Namaste. My name is Dr. Chaitra S. Nirantar. I'm an obstetrician and gynecologist working in the Department of Reproductive Immunology in Chandray Rheumatology and Immunology Center. Today, let's talk about one of the commonest complaints that women in their reproductive age group experience: vulvovaginitis. It's also called the yeast infection or the fungal infection. Now, why this topic in particular? First and foremost is because most of the reproductive age group women do experience this particular infection. Before knowing what is vulvovaginal candidiasis, let me just tell you what is a normal flora of the vagina. Many patients ask me, Madam, really, are there presence of a lot of bacteria or fungal in the vagina? Well, the answer is yes. Normally, the vagina has its own friendly flora. Small bacteria, small fungus, and predominantly the lactobacillus. Lactobacillus is one very important component which is present in the vaginal flora. It has its own benefits. It produces hydrogen peroxide and lactic acid, which keeps the vaginal pH acidic. When it keeps it acidic, it prevents the growth of other pathogenic or any other bacteria or fungus which can cause harm to us. So lactobacillus is one of the very important organism which is present in the vagina. When this particular flora is altered is when the infections are possible in the vagina and the vulval area. So who are the people who are commonly going to experience the vulvovaginitis? Predominantly women who are immunocompromised. When I say immunocompromised, when their immunity is low. That can be in diabetes, it can be in HIV positive women, women who are taking long-term antibiotics. When they take long-term antibiotics, inevitably, the normal flora is destroyed in the vagina. Who are the other women? Women who are taking women who are taking other drugs, which is going to reduce the immunity in the body, like long-term use of steroids, predominantly in women who have autoimmune conditions. So these are the women who can have the risk of developing vulvovaginitis. Pregnancy, one of the commonest time where women do experience vulvovaginitis. As you all know, pregnancy by itself is said to be an immunocompromised status. So the women becomes more prone to developing vulvovaginitis. How do these women come to clinic? Most of them come to the clinic by saying, ma'am, I'm having vaginal itching. It's too much. I can't control the itching. They can have redness and soreness in the vaginal and the vulval area. They can have continuous discharge. And the typical for the commonest vulvovaginitis, which is the yeast infection, which I'm going to be talking to you about, is cottage cheese kind of appearance. This itching is quite disturbing. The normal routine is disturbed. So do we have any other common symptoms they come with? Some women will have painful intercourse. And some of them can also present with burning maturation. So whenever women come with such complaints, what we do is do a complete examination. We will do a per speculum examination to examine if there is presence of these white discharges, what kind of white discharge is present, what is the area of extent, are there any lesions along with these. So per speculum examination becomes very essential. Now, what is the treatment for it? Well, most of commonly what I'm seeing is people just go to medical stores and over counter they are buying drugs, which is not suggested. You make sure that you meet your obstetrician, find out what is the cause, because candidal vaginitis is not the only one. There can be other causes of vaginitis. So what we give them is usually anti-fungal pessaries, which is locally they can insert the pessary into the vagina and it has an effect very locally over the vagina. Sometimes creams are also provided. When do we give them oral antifungal? Well, it becomes very essential for us to explain to the patient that antifungal may not be very safe for you in pregnancy or if you're planning pregnancy. Also, it is the dosage alters when you are having a simple episode and when local vaginal pessaries can do the action, then it's more than sufficient. But if it is required, we may also give you oral antifungal. And that may be for a long term also. The commonest in which I personally suggest my patients are probiotics. Nothing but these lactobacillus will increase in the concentration of in their vaginas. So some of them I also prescribe for 30 days and some of them in the last 15 days of their cycle. So probiotics, a big yes. The last thing what I want to tell you all is always remember that the normal vaginal flora should not be disrupted. So do not douche anything inside the vagina. It has the capacity to keep itself healthy and clean. Do not insert any scented soap or liquids into the vagina. Do not use harsh soap as well inside the vaginal area. So the simple cleaning with lukewarm water is more than sufficient, but it is not required for you to insert it into the vagina. So do take care. And if you are experiencing any of these symptoms, make sure that you meet your obstetrician and gynecologist. Thank you.